let's talk about chest tubes. What are chest tubes? Chest tubes are also called thoracostomy tubes. So here's a gentleman who has a thoracostomy tube draining either air or fluid from his pleural space. What are chest tubes? They're long, semi-flexible plastic tubes. They come in all sorts of shapes and sizes. Chest tubes are inserted into the chest so that they can drain collections of air or fluids, and usually both, from the pleural space. So here's air in the pleural space. Air in the pleural space is pneumothorax, and this causes the lung to collapse. So here on the pneumothorax side, we have a collapsed lung. Over here, we have a normal lung that's completely inflated. Normally, there is no air in that pleural space. The pleural space is two little pleural linings rubbing against each other with a teeny tiny amount of fluid to provide lubrication. So normally there's no air in the pleural space. The pleural space really isn't a space at all until you put air or fluid into it. So normally there is no air in the pleural space, and this keeps the lung completely inflated. However, when air gets into the pleural space, then the lung can collapse. So air in the pleural space, again, is pneumothorax. This collapses the lung. Here we have blood in the pleural space, and this is called hemothorax. Hemo, blood, thorax, chest. And notice the blood in the pleural space is collapsing the lung. On a chest x-ray, on any x-ray, stuff is white and air is black. So since the lungs are full of air, they're going to appear darker on the x-ray, and stuff on the x-ray will appear white. Purulent fluid, otherwise known as pus, in the pleural space is called empyema. And so here's an empyema. It has collapsed the lung on that side. And notice the lung is completely inflated on this side. So if air or fluid get into the pleural space, the lung will collapse. And most of us can endure that as a chronic process over time. However, if air compresses inside of the pleural space, this will compress the heart and compress the major blood vessels. And this can be lethal in a matter of minutes. And this is called tension pneumothorax. So please do not confuse tension pneumothorax, which is immediately deadly, with the other pneumothoraces, the other pneumothoraxes.